I analyzed 50 plus health tech job postings, and here are 15 things that surprised me. I spent 5 days going through more than 50 real health tech job postings. Postings from companies like Biogen, Philips, Accenture, and many others. I analyzed every one of them, the technical skills, the domain knowledge, the education requirement, the certifications, the experience levels, the soft skills. And what I found was genuinely surprising. 15 things that challenge what most career advice tells you about getting into health tech data. Whether you're thinking about transitioning into this space or you're already in it and want to understand the full landscape, this video is going to shift your perspective. Let's get into it. There are 25 distinct data role titles in health tech based on the job postings that I analyzed. And most people thinking about health tech data know about maybe three roles like data analyst, data scientist, and maybe data engineer. I found 25 different title categories across these postings. Things like radiology informatics analyst, value-based care data analyst, interoperability analyst, real-world evidence analyst. These are real roles at real companies with real job postings. Each one has different skills, different experience requirements, different career trajectories. The landscape is much wider than people realize, and that's actually good news for career changes because it means there are more entry points than you currently think. Surprise number two, the roles span 7 completely different types of employers. Health tech in itself doesn't just mean hospitals. Hospital systems like Intermountain and UCSF. There's also pharma companies like Biogen and UCB. There is insurance companies like Elevance Health, consulting firms like Accenture. There's also medical device companies like Philips and Smith. And there is startups like Sprinter Health and Sego Health. There's also community health organizations. Each type has a different culture, different pay, and different skills they prioritize. We'll come back to this. Surprise number three, SQL or SQL is the single most requested skill, not Python and not AI. SQL appeared in roughly 15 to 18 of the 25 role categories. Python appeared in about 8 to 10. AI and machine learning were just in about 6 of them. SQL or SQL appeared in 3 times more role categories than AI. Think about that. And here's the thing. SQL shows up differently at different levels. Like for analysts, it's basic queries and reporting. Then for engineers, it's complex pipelines in Snowflake and BigQuery. For architects, it's database design and data modeling. One skill, universal across the field, and it's not the one getting hyped on social media. Think about that. Surprise number four, advanced Excel is still required in about 10 role categories. I know, not exciting at all, but pivot tables, formulas, and data validation appeared at companies like Model Health, Lockton Community Clinic, and others. Don't skip it because it feels too basic. Surprise number five, healthcare domain standards appeared more often than Python. HIPAA, FHIR, HL7, ICD-10, SNOMED, and claims data knowledge. Collectively, these appeared in more role categories than Python did. This is the insight that changes everything for career changes. Python gets you into any tech company, at least the ones that use Python, right? But HIPAA, FHIR, and claims data knowledge is what gets you into a health tech company specifically. And the good news is that all of this is self-teachable or self-learnable. You don't need a clinical background to learn what HIPAA is or the HIPAA basis or even to understand what FHIR is. Surprise number six, Azure dominates healthcare cloud, not AWS. In the data engineer and data architect postings, Azure appeared with deep specificity. like Azure Databricks, Azure Data Factory, Azure Synapse, Microsoft Fabric, Azure Key Vault, Azure DevOps. Healthcare runs on Microsoft. Active Directory, Office, Teams. Azure is the natural cloud extension. And in my personal experience with the companies I've worked with, the ones in healthcare also use Azure as the main thing, like Microsoft as the main product, even though they had multi cloud. If you're studying for cloud certifications to enter health tech, consider Azure DP 203 before AWS. Surprise number 7. AI and ML ranked dead last in skill frequency. Only about 6 of 25 role categories mention AI or machine learning, and those were specifically data scientists and data engineering roles, at least when we talk about the health data roles, which was the focus of this analysis. Most health tech data jobs, like the analysts, the informatics specialists, the BI roles, and the clinical data managers, don't require AI skills today, at least not yet. Despite all the headlines about AI transforming healthcare, the actual hiring is still heavily focused on fundamentals. However, in my next set of analysis, I'm going to focus primarily on healthcare AI roles. All right, so SQL, domain knowledge, EHR systems, and data governance, those are the important skills that you need now. Surprise number 8. 14 of 25 roles are accessible with 2 years of experience or less. This was one of the biggest findings. More than half of health tech data role categories listed minimum experience of 2 years or less. Roles like health data analyst at CNS required 2 years. Pharmacy data analyst at Lockton was 1 to 2 years. Value-based care analyst at community clinic, 2 years. And the most surprising one, surprise number 9. Philips has a radiology informatics role requiring 0 years of experience. And yes, you heard that. 0 years of experience. No prior experience required if you come with a bachelor's degree. A role at Philips working with PACS and DICOM and medical imaging systems. 0 years experience, just a bachelor's degree. I'm not saying every posting is this accessible, but this proves that entry-level health tech roles exist at major companies. Surprise number 10. Only 6 of 25 roles require a clinical background. The biggest myth in health tech careers is, oh, I can't work in healthcare because I am not a nurse or doctor. 19 of the 25 roles that role category actually do not require clinical experience. They want technical skills plus domain knowledge, and domain knowledge can be self-taught. This is different from the clinical experience that doctors, pharmacists, nurses, and other healthcare professionals have. Surprise number 11. Equivalent experience appears repeatedly in education requirements. Multiple job postings say bachelor's degree or equivalent experience. This is a signal that demonstrated skill can outweigh credentials. Surprise number 12. The experience distribution is bimodal and not a ladder. Roles cluster at 0 to 3 years and then they jump to 5 to 10 plus years. The 3 to 5 year middle is underrepresented in external postings. This suggests that companies usually promote internally at mid level. For career changes, get in through the entry level cluster. The mid level path would open up from inside. Surprise number 13. The certifications employers listed are niche and specific, not the popular ones that most people talk about. Epic certifications, CHDA, CPHIM, CIIP, Databricks, Azure DP 203, these are what appeared in the postings. Google Data Analytics certificates, no. There were no mentions of it. IBM data science, no mention. Generic bootcamp credentials, no mention of such. I'm not saying those are worthless for learning, but they don't differentiate in health tech specifically. Surprise number 14. Pharma and hospital data roles are completely different careers. Clinical data scientist at Biogen needs CDISC standards and Medidata Rave, ICH regulatory knowledge, and ideally a PhD. Population health data analyst at Elevance Health needs Epic Clarity, Hedis metrics, claims data, and a bachelor's degree. Same industry, but completely different vocabulary, tools, education, and career path. Before you say, I want to work in health tech, you need to decide pharma, hospital, insurance, medical devices, consulting, startup, or community health. The answer changes your entire study plan. And the last surprise number 15, every single posting asks for the same soft skill, not just good communication, but something more specific. Your ability to translate technical findings for non-technical stakeholders. Variations of this appeared in virtually every posting. CNS Healthcare says, explain, so your ability to explain technical issues to technical and non-technical stakeholders. Sprinter Health says influencing decisions through data insight and storytelling. Sego Health says translating technical work for non-technical partners. In healthcare, your stakeholders are doctors, nurses, administrators, and executives. These people don't speak data, so you need to speak their language. So those are the 15 findings. Let me summarize the actionable takeaways for you. 1. The landscape is wider than you think. There are 25 roles, 7 employer types. Pick your lane. 2. SQL is king. Domain knowledge is queen. AI is just a court jester right now, at least for the health data roles. 3. More than half the roles are entry friendly at 2 years or less. 4. You almost certainly don't need a clinical background. 5. Azure over AWS if you are going the engineering route. 6. Get niche certifications, not generic ones. 7. Pharma and hospital side are different worlds. Decide early on that. 8. Get in through the entry cluster and grow from inside. I'm going to be breaking down each of these findings in more detail in upcoming videos and posts. If you want to follow this series, make sure to subscribe and hit the notification bell. And if you're currently planning a transition into health tech, data, or any aspect of health tech, go ahead and drop a comment telling me your background and also which role surprised you the most. I read every comment and I'll see you in the next one.